Transgender youth healthcare bans have a new target: adults. Who could have seen this coming? Lawmakers in at least 3 states this year have filed legislation meant to restrict access to gender-affirming healthcare for individuals as old as 26, an escalation of a battle waged nationwide last year over whether minors should be able to access certain prescription medications and procedures. Bills filed this year in Oklahoma, South Carolina, and Virginia aim to bar state healthcare providers from recommending or administering treatments like puberty blockers, hormones, and gender-affirming surgeries to patients younger than 21, signaling an aggravation in the fight over transgender healthcare. Another Oklahoma bill filed this month would prohibit adults up to 25 from receiving gender-affirming care in one of the most extreme and restrictive bans introduced to date. The state's proposed Millstone Act, which gets its name from a Bible verse about punishing adults who harm children, would also block Oklahoma's Medicaid program from providing coverage for gender transition procedures to individuals younger than 26. Quite the escalation, if I do say so myself. I don't think it was ever about children, Aaron Reed, an independent legislative researcher, told The Hill this week, referring to state and federal attempts to ban gender-affirming care over the past 2 years. GOP legislators' arguments against transgender healthcare have in the past centered around a need to protect children from alleged predatory doctors and quote-unquote woke gender ideology. Bills filed across the country last year used inflammatory and misleading rhetoric to disparage gender-affirming healthcare for youth with titles like Save Adolescents from Experimentation Act and the Protect Children's Innocence Act. Yeah, this is a common trend with a lot of bills that are introduced into the legislature, is that they use the title of the bill to kind of like virtue signal or whatever. It's really absurd. These adult bans show that that's not what it was about, Reed said. It's about banning care entirely. It's about forcing transgender people back into the closet. State legislators haven't moved away from youth healthcare bans entirely, and dozens of bills seeking to ban gender-affirming care exclusively for minors have already been introduced in more than 10 states this year. Reed added that she's skeptical whether legislators sponsoring adult healthcare bans this year expect those measures to pass as written. It's likely, she said, that lawmakers are targeting older individuals to make youth healthcare bans appear less extreme and more palatable. That's a good point. Yeah, I could certainly see that. This is, in part, a way that they're trying to make it easier to pass gender-affirming care bans for smaller groups in the population, she said. Efforts to restrict transgender adults' access to healthcare lean heavily on claims from so-called gender-critical organizations that young people should not be recognized as adults before they turn 25, when the human brain is believed to reach full maturity. State GOP lawmakers in Missouri last year weighed extending a proposed youth healthcare ban to adults under 25, arguing that individuals even into their early 20s are unable to fully consent to gender-affirming interventions. Does that mean we should raise the age for alcohol to 25? Does that mean we should raise the age for tobacco to 25? Does that mean we should raise the age to enlist in the military to 25? Does that mean we should raise the age of consent to 25? There's a whole host of questions here. If you say adults over 18 can't consent to stuff, and there's a lot of stuff there that we need to change quick. That and similar claims have been disputed by medical experts and physicians with experience treating transgender youth, and multiple inquiries have found that affirming a child or adolescent's gender identity can improve their mental health outcomes into adulthood. Passing laws to delay healthcare deemed medically necessary by most major medical associations is also dangerous, according to Dr. Meredith McNamara, an assistant professor of pediatrics at Yale University, and runs the risk of worsening rates of anxiety, depression, and suicidality among transgender youth and young adults struggling with gender dysphoria. Nearly 20% of transgender non-binary 13 to 24-year-olds surveyed last year by the Tramer Project, a leading LGBTQ youth suicide prevention organization, said they had attempted suicide in the past year. Fewer than a third said their gender identity was affirmed at home. From McNamara, who treats transgender youth aged 11 to 25, said the primary concern with adult healthcare bans lies with individuals under 21, or 26 in Oklahoma's case, who are already receiving gender-affirming healthcare. There are people currently on treatment, living as their authentic selves and experiencing relief from gender dysphoria who face forcible detransition, she said. None of the proposed measures include language or provisions that explicitly address transgender youth and young adults already receiving medications like hormones or puberty blockers. Of course not. It's like Aaron Reed said. It's just about detransitioning people. It's about erasing transgender people. And this kind of goes back to like the Q&A question about whether I think there's like a trans genocide or something like that. Right? Like, certainly I wouldn't call it at that level at this point, but, you know, stuff like this does not help. Does not help support the argument that there isn't going to be a trans genocide. Just saying. This is the kind of stuff that you should push against, right? This is the important kind of stuff that everyone in the community needs to be united behind, right? Like, obviously the Oklahoma bill about, 26 is absurd. And whether you're on one side of the argument or the other, if you're trans or non-binary, you should have the same opinion as everyone else on this. Period. That's how I feel about it. Efforts to restrict gender-affirming healthcare for adults also risk backfiring by limiting the freedoms of individuals who can legally vote, drink a beer, and go to war. Oh, what did I just say? What did I just fucking say? They also discriminate based on sex and transgender status, according to Chase Strangio, Deputy Director for Transgender Justice at the American Civil Liberties Union, LGBTQ, and HIV Project, making them unconstitutional. It's not about protecting anyone, Strangio said of recent legislative efforts to restrict gender-affirming care. It's about an opposition to trans identity. Yeah. I agree. 100%. This article from The Hill, very, very good. Very good. Sad about the news, but important to talk about for sure.